So we've done lots of work for Voice of BME for a long time now, but then it all obviously suddenly changed last year. It feels like longer than last year, doesn't it? So March 2020, when everything was just thrown in the air, wasn't it? And it was just horrifying to see what was unfolding. And I think we can't not say that health inequalities now, we can't move away from health inequalities. COVID has absolutely shone a light on health inequalities and the unjust nature of health inequalities. So although Trafford, if you look at all our indicators, we look like we're really, we're all a healthy, very healthy borough and everybody's living this amazing life, but that isn't so. If you dig below, there are some significant inequalities across Trafford. And that's something that COVID has absolutely identified for us. So when we say that COVID doesn't discriminate, the facts for Trafford have shown that it does absolutely discriminate. The figures that we've seen in particular are, so a national figure, for example, that I saw this morning that was horrifying, is black and black Caribbean men and women, their death rate was 4 times higher than white groups during the pandemic, which is just a horrifying statistic when we think of that. And when we looked at IVCU admissions, so intensive care admissions, 34% of intensive care admissions were for Asian and Asian British people, whereas in the population in total it's 13%, so completely disproportionate to what we saw across our population. Locally, our rates have mirrored this, so we've seen much higher rates in our Asian and Asian British population, our black and black British and our mixed population as well, and that's something that we've been really, really cognizant of in our COVID response. And so we've worked with Voice of BME, and we've worked with our community engagement colleagues, so I can see Bernie over there as well. So, and they've done an amazing job going out into the communities, working across groups, ensuring that public health is still rolling even though we're in this lockdown, which for many of us is really hard to kind of understand during that point in time. But I think we have to recognise that the pandemic isn't over, so our rates have been declining in Trafford, but unfortunately, and I don't want to say this out loud, but I'm going to have to, we're starting to see a slight upturn again. So we do need to be careful, we do need to be thinking of all the COVID safe behaviours, social distancing, hand washing, symptom awareness and testing that we've been doing all the way through. But we will continue to rely on our colleagues in Voice of BME to support us with that. An inequality that we do see in Trafford is our inequality in vaccine uptake, and we know that vaccination is really, really important in terms of combating COVID. And we have overall, so 80% of our population have had their first dose, which is really high levels, but only 50% of our black and black British population have. So this is an area that we really need to focus on across Trafford, and we'll continue to do that. So a piece of work that Voice of BME were commissioned to do, and have absolutely smashed it like they always do, is doing conversations from practices to encourage people who haven't been vaccinated to get vaccinated. And we know that those conversations encouraged 80 people to get the vaccine, and that's really, really significant, because that's potentially 80 people whose families are less impacted on by COVID, less likely to be admitted to hospital, and less likely to die. So these are all very stark figures, but really important figures. So we're heading into recovery, even though I've just told you that our rates are going slightly up, but we are feeling, we're trying to be positive and look forward. And I know that our recovery will be very much supported by Voice of BME, cancer work and the mental health work and everything else we do out in the community. So just to close really, I just wanted to say an absolute huge thank you to everybody, particularly our community volunteers and particularly Voice of BME for helping us through what has been I think we can only describe a very challenging 18 months. So thank you all very much.
We can't eat healthy, we can't join gyms. So my call on that was the BME is providing you some of the things like free exercise classes, free yoga classes, free healthy hearts and hips exercises classes. We also conducted Afro-Bollyfit classes as well, which the details are in the pack. So all of these things we have been doing to make sure that what we can do. Yes, there are so many things which we can't do, but let's focus on the things which we can do with our means in Trafford. So I would also like to, because we're talking here about the cancer awareness sessions, but there is also a project which we are funded by Trafford Council, and that is working within the practice and talking to women for screening. And this bar actually shows a bit of the statistics. So we can say in December, when we were in the lockdown situation, things were not very good. And but you can see from the July and September, the calls rate, and the red bar indicates that how many screenings were booked in that quarter.
Pandemic. Obviously, your ongoing programs, your health and wellbeing programs funded by the lottery, there's always going to be a need for those. But we will need you too to carry on with the work you do to promote and support good mental health. We'll need that more than ever as we begin to come to terms with what has happened to all of us over the last 20 months. And we also, of course, need the work you do to destigmatise mental health, certain screenings, to bring people to a position where they feel confident that this is good for them and good for their families, and something that everyone can and should participate in. And we also, of course, need to remember, as Khan said, that you have a really important role as advocates, it's in your name, isn't it? Voice of BME Trafford, as advocacy. Your work on advocacy and voice matters so much. And when Han talked a few moments ago about the impact of hunger on children and families in our community, and the need to push the government to address that childhood hunger, to address the need for good quality public health programmes, to address the need for investment in programmes of screening and mental well-being, your advocacy work, your voice is as important as the work you do to engage with families and individuals one-to-one. So I just want to conclude by saying thank you so much. Congratulations on everything you have achieved. I've rarely seen work quite as effective as the work you have done over the last few years. It's unusual for me to see programmes where the impact is so demonstrably successful as Voice of BME Trafford have achieved with the funding that you've secured. And I'm really delighted to be here today to celebrate that, to thank you for all you've done, and to say to you, I'm here to champion you, here to promote you, here to make sure people know about the good work you do, and here to say that anything I can do to support your continuing to fulfil this key role that you perform in our community, I stand right by you. Just ask me. I'll do everything I can to make sure you can carry on your fabulous and important work. Thanks so much for inviting me to be here with you again today.
Now we do know within Trafford, and we've talked about some of the inequalities which Kate has mentioned herself. We know life expectancy is a key measure in health status of the population of Trafford and beyond. And we know it's closely related to deprivation in our communities and the impact it has on BME communities. In particular, we wouldn't be here, and Adele and her involvement in helping to set this organisation up would not be here if we didn't have these problems and these issues which are across the world. So we're honoured as Voice of BME to be able to do our little bit, because if everybody's doing something, change will definitely happen. So we want to continue mainly around the prevention of ill health. We're very much about creating stronger awareness raising, and that's mainly what we do in terms of helping to make a difference. And we don't want people of Trafford to be a statistic. We want health where it matters. And I think a lot of what Pauline said in her poem, her bespoke poem for Voice of BME, did actually sum up what we actually want to do. We want to try as much as we can to influence change, and that's in our strap line, and that's exactly what we want to do. We want to influence communities, authorities, organisations. We want to work in partnership. There's so much we want to be able to do around this. So really, part of what we want to do is reduce levels of poor health. That's one of our key areas of focus currently. There's many other areas we'd like to get involved in, and we've started touching on some of them around confidence building, training into employment, and we've been tackling some of those issues for some of our members of our community. But we want to be able to contribute to tackling aspects of the root cause that we know impact our communities around health. We want to focus on improving lifestyle, particularly. A lot of our programs are very much about encouraging lifestyle, and we're really happy to see a lot of members of the community that have been part of our programs here today, supporting and helping us to continue to listen to you, because it's you who make that difference for us.
I mean, it is an absolute pleasure to be here, and it's so incredible just to see so many people in the audience, so many people who are known to Voice of BME and just known to be active in the community. A couple of words about Trafford Community Collective. You might expect me to mention it. We didn't exist a year ago. You know, we have been working to develop this collective approach for about 3 years. But it was only last year, maybe as a result of COVID, where we started coming together. We got some money from the local authority and we became a registered charity in March of this year. And I mention that in the context of how much support we've had from other community organisations, and in particular Voice of BME, and in particular CAN. I think the work that CAN has supported and led on has really enabled us to become the organisation that we want to be, which is that we will focus on collaboration, we're focusing on co-production, and we're focusing on communication, and we're looking to build a sort of bridge between communities and statutory organisations. We've been referencing throughout the last half an hour or so health inequalities. I maybe picked up from CAN, been a little bit active for the last few years. And certainly for the last 10 years, Trafford has had a strategic priority to reduce health inequality. But if you actually look at the achievements and the outcomes, it's not done very well. And I think what COVID has done and where we are now is that we're learning, if you're going to reduce health inequality, you need to take a different approach. You can't expect statutory providers to reduce health inequality. You can't expect a top-down approach to reduce health inequality. You've actually going to have to go and talk to people living in communities and engage them and help as much as you can them to become empowered to do things for themselves. It's absolutely incredible that that's what Voice of BME does. You know, if we're looking for an example of how to do it, then we can work with Voice of BME and we can learn from Voice of BME. Helen touched on some of the work that the Voice of BME have been leading on from a community perspective, working in partnership with the engagement team. For me, it's not only what they've done, it's the way in which they do it. So You ask if they can help, and the first answer is yes. And then it's like, how can we help? So if you want an organisation to go out and talk to people, to be knocking on doors, to be engaging with people at that level, then that's the organisation to talk to.